Most people believe that if they're having a heart attack, they'll know it immediately. They imagine crushing chest pain, a numb left arm, cold sweat, and a dramatic collapse. That's what television has taught us. That's what many people expect. But after more than 20 years as a cardiac surgeon, I can tell you that reality is often far more frightening. Some of the deadliest heart attacks don't announce themselves at all. They happen quietly, in the middle of the night, while a person is fast asleep. No severe chest pain. No desperate call to 911. No opportunity to ask for help. Sometimes, there isn't even enough time to wake up. I've stood in operating rooms before sunrise, holding a damaged heart that only hours earlier had seemed perfectly healthy. I've spoken with husbands, wives, sons, and daughters who all told me the same heartbreaking story. They were completely fine before bed. Those words have stayed with me throughout my career because I've heard them far too many times. The truth is that many people over the age of 60 don't realize that the most dangerous hours for their heart aren't necessarily during exercise or periods of stress. For many older adults, the greatest danger comes between midnight and 6 o'clock in the morning, when the house is silent, the lights are off, and everyone believes the body is safely resting. What shocks my patients even more is discovering that these nighttime emergencies are often influenced by something surprisingly ordinary, but simple evening habits repeated day after day without ever realizing the damage they may be causing. Over the past 2 decades, I've watched the same patterns appear again and again. Different patients, different families, different lives. Yet many of them shared remarkably similar routines before going to bed. That's exactly why I decided to make this video. Today, I'm going to walk you through 5 common bedtime habits that may quietly increase your risk of a heart attack while you sleep. More importantly, I'll show you simple changes that can help protect your heart without turning your life upside down. But before we begin, it's important to understand why the nighttime hours become so much more dangerous after 60. While you're asleep, your heart doesn't stop working. In fact, your cardiovascular system enters an entirely different operating mode. In a healthy body, blood pressure naturally falls, the heart beats more slowly, and blood vessels relax. This nightly slowdown gives your heart a chance to recover from the demands of the day. As we grow older, however, that protective system becomes less reliable. Arteries gradually become stiffer. Blood pressure is no longer regulated as smoothly as it once was. The body's ability to adapt to sudden changes becomes weaker, leaving much less room for error. That's one reason why cardiologists pay such close attention to what happens overnight. Between midnight and 6 in the morning, your body's natural defenses are at their lowest, making this one of the highest risk periods for serious cardiac events in older adults. And here's the part I hope you'll remember throughout this entire video. What happens to your heart while you sleep is often determined long before you close your eyes. The meal you eat, the medication you take, or forget to take, the water you drink, even the temperature of your bedroom. Small decisions made during the evening can quietly shape what happens to your heart before morning arrives. And the first habit on our list is one that surprises almost every patient I meet. Habit 1. Eating dinner too late or too much. Let me ask you a simple question. What time did you eat dinner last night? And just as importantly, how much did you eat? When I ask my patients this during a follow-up appointment, I hear the same answers over and over again. Doctor, I usually eat around 8, sometimes closer to 9. We don't finish dinner until everyone gets home. For many families, that's completely normal. After a lifetime of following the same routine, eating a large dinner late in the evening doesn't seem like something worth worrying about. But from the perspective of your heart, it may be one of the most overlooked bedtime habits of all. Here's why. Every time you eat a large meal, your digestive system immediately goes to work. It requires a tremendous amount of blood to help break down food and absorb nutrients. To meet that demand, your heart has to pump harder and circulate more blood throughout the body. Your blood pressure may rise, and within a few hours, triglyceride levels, the fats circulating in your bloodstream, also increase, During the daytime, your cardiovascular system usually handles this extra workload without much difficulties. But late at night, your body is trying to do something entirely different. It is preparing for rest. Your heart wants to slow down. Your blood pressure is supposed to fall naturally. Your blood vessels begin to relax so your body can enter its nightly recovery mode. A heavy dinner forces your heart to move in the opposite direction. Instead of resting, it keeps working. Instead of slowing down, it continues supporting digestion. Those two processes compete with each other, creating unnecessary stress on a cardiovascular system that has already become more vulnerable after the age of 60. The consequences are often invisible. Nighttime blood pressure may remain higher than it should. Acid reflux becomes more likely, sometimes causing chest discomfort that can easily be mistaken for heart-related symptoms. Sleep quality declines because the stomach is still working while the brain is trying to recover. Night after night, this repeated strain may quietly increase the burden on your heart. The good news is that this is also one of the easiest habits to change. Whenever possible, try to finish your main meal between 6 and 7 in the evening. This gives your body 3 or more hours to digest food before you go to bed, allowing your heart to transition naturally into its nighttime recovery. If your schedule forces you to eat later, don't make it your largest meal of the day. Choose a smaller portion. Focus on lean protein such as fish or skinless chicken, along with vegetables or a light salad. Avoid heavy fried foods, rich desserts, or oversized portions that require hours of digestion. Remember, protecting your heart isn't only about what you eat. Sometimes it's also about when you eat. And the next habit surprises even more of my patients, because many believe they're protecting their health, when, in reality, they may be leaving their heart vulnerable during the most dangerous hours of the night. Habit 2. Taking your blood pressure medication at the wrong time. If you're over the age of 60, there's a good chance you're taking medication for high blood pressure. Millions of older adults take it faithfully every morning with breakfast and assume they're protected for the rest of the day. In many cases, that's exactly what they were told to do years ago. But here's what many people never learn. Blood pressure doesn't stay the same for 24 hours. It follows a natural daily rhythm. In healthy individuals, blood pressure gradually falls after bedtime. This nighttime drop gives the heart and blood vessels a chance to rest and recover. Cardiologists often call this the dipping pattern, and it's an important sign that the cardiovascular system is functioning normally. However, many older adults no longer experience that healthy decline. Instead, their blood pressure remains elevated throughout the night or even begins to rise while they're asleep. This condition is known as nocturnal hypertension. Most people have never heard of it, yet it is one of the hidden reasons serious heart problems often occur before sunrise. If your blood pressure medication is taken only in the morning, its effect may begin to wear off by the middle of the night, precisely when your body needs protection the most. That doesn't happen with every medication, because different drugs last for different lengths of time. But for some people, the timing can make a meaningful difference. Imagine an artery that has slowly narrowed over many years because of cholesterol buildup. During the quiet hours of the night, an unexpected surge in blood pressure can place tremendous stress on that weakened area. A vulnerable plaque may rupture. Once that happens, the body immediately forms a blood clot in an attempt to repair the damage. Unfortunately, that clot can suddenly block blood flow to the heart. Within minutes, a heart attack begins. And because it happens while the person is asleep, there may be no warning and very little time to respond. This is one reason doctors have become increasingly interested in chronotherapy, the science of matching medication timing with the body's biological clock. One of the most widely discussed studies in this field was the Hygia chronotherapy trial, which suggested that, for certain patients with hypertension, taking blood pressure medication at bedtime was associated with better nighttime blood pressure control and a lower risk of cardiovascular events than taking it only in the morning. Although researchers continue to study this topic, and recommendations may differ depending on the specific medication and each person's medical history. The study highlighted an important message. Timing matters. So what should you do? Don't change your medication schedule on your own. Instead, bring up this question during your next appointment. Ask your doctor, is the time I'm taking my blood pressure medicine still the best choice for me? That simple conversation may take less than 2 minutes, but it could help ensure your medication is protecting your heart during its most vulnerable hours. And while medication timing is important, there's another nighttime danger that many families dismiss for years because they mistake it for nothing more than loud snoring. Habit 3. Ignoring sleep apnea because it's just snoring. For years, snoring has been treated like an inconvenience rather than a medical problem. Couples joke about it. Families get used to it. Some people even move into separate bedrooms because of it. But as a heart surgeon, I hear loud snoring very differently. I hear a possible warning sign. Not everyone who snores has sleep apnea, but many people with sleep apnea snore loudly, and the condition often goes undiagnosed for years. Here's what actually happens. Instead of breathing smoothly throughout the night, the airway repeatedly becomes partially or completely blocked. Breathing may stop for 10 seconds, 20 seconds, sometimes even longer. These episodes can occur dozens of times every single hour. Each time breathing stops, the oxygen level in the blood begins to fall. Your brain immediately recognizes that something is wrong. It responds as though your body is facing an emergency. Stress hormones such as adrenaline are released. Your heart rate suddenly jumps. Your blood pressure rises. Your body briefly wakes itself, just enough to reopen the airway before you fall back asleep again. Most people never remember these awakenings. They think they've slept through the night. In reality, their heart has been forced into an endless cycle of stress, over and over again, sometimes hundreds of times before morning. Imagine someone shaking your shoulder every few minutes all night long. You would never truly rest. Your heart feels something very similar. Over months and years, this repeated strain begins to damage the cardiovascular system. Research has shown that untreated sleep apnea is associated with a dramatically higher risk of heart disease. Studies have found that it can increase the risk of heart attack by as much as threefold in some individuals. It is also closely linked to atrial fibrillation, one of the most common abnormal heart rhythms in older adults, and significantly increases the risk of stroke. What makes sleep apnea especially dangerous is that many people don't realize they have it. So what signs should you watch for? Of course, loud snoring is one clue, but there are others that are often overlooked. Do you wake up with a dry mouth? Do you have frequent morning headaches? Do you feel exhausted even after spending 7 or 8 hours in bed? Has your spouse ever told you that you stop breathing or suddenly gasp for air during the night? Do you find yourself waking up choking, coughing, or feeling as though you can't catch your breath? If you answered yes to any of these questions, please don't ignore them. The next step isn't to panic, it's to get evaluated. Talk with your doctor about having a sleep study. Today, many sleep studies can even be performed at home using portable monitoring equipment, making the process much easier than many people expect. If you're diagnosed with sleep apnea, the most effective treatment for many patients is a CPAP machine. I know some people hesitate because they think the mask looks uncomfortable. But after years of caring for heart patients, I've seen how life-changing this treatment can be. By keeping the airway open throughout the night, CPAP helps maintain healthy oxygen levels, reduces nighttime blood pressure spikes, lowers strain on the heart, and improves sleep quality. While you're waiting for an evaluation, there's one simple habit that may also help. Try sleeping on your side instead of your back. For many people, lying on the back allows the tongue and soft tissues to fall backward, making the airway more likely to collapse. Sleeping on the side can reduce these episodes and improve airflow. Although it is not a substitute for proper diagnosis and treatment, the frightening thing about sleep apnea is that it works silently. You don't see it, you often don't feel it. Yet your heart experiences every single episode, and the next bedtime habit is just as common because it begins with something that almost everyone believes is actually good for them. Habit 4. Going to bed slightly dehydrated. In fact, many older adults believe they're doing exactly the right thing. They intentionally stop drinking water in the evening. When I ask why, the answer is almost always the same. I don't want to wake up 3 times to use the bathroom. That's a completely understandable concern. Frequent nighttime trips to the bathroom interrupt sleep, leave people feeling exhausted the next morning, and increase the risk of falls in the dark. For someone with arthritis or balance problems, avoiding those trips seems like the safest decision. Unfortunately, when you don't drink enough fluids before bed, your body gradually becomes mildly dehydrated during the night. You may not feel thirsty. You may not notice any obvious symptoms, but important changes are already taking place inside your bloodstream. As the amount of fluid in the blood decreases, the blood becomes more concentrated. Many people simply describe this as the blood becoming thicker. It doesn't move through blood vessels as easily as it should, especially through arteries that have already become narrowed by years of cholesterol buildup. Now think about what else is happening while you're asleep. Your heart is beating more slowly. You're lying still for 7 or 8 hours. Blood circulation naturally becomes less active because your muscles aren't moving. When slower circulation is combined with more concentrated blood, conditions become more favorable for unwanted blood clot formation. For a healthy young person, the body often compensates without difficulty. But after the age of 60, the margin for error becomes much smaller. If plaque is already present inside the coronary arteries, a clot can develop more easily and may suddenly block blood flow to part of the heart. That is one reason serious cardiac events occur so often during the early morning hours. The good news is that protecting yourself doesn't require drinking large amounts of water before bed. A single small glass of water, about 8 ounces or roughly 240 milliliters, is enough for many people. It provides your body with the fluid it needs without dramatically increasing the likelihood of multiple bathroom trips. Another simple habit can make a difference as well. Keep a glass or bottle of water on your bedside table. If you wake during the night and notice that your mouth feels dry, or you feel genuinely thirsty, take a few small sips before going back to sleep. Your body is giving you useful information, and it's worth listening to. Of course, some people have medical conditions, such as heart failure or advanced kidney disease, that require restricting fluid intake. If your doctor has given you specific instructions about how much to drink, always follow those recommendations rather than making changes on your own. For everyone else, don't let the fear of one extra trip to the bathroom leave your heart without the hydration it needs for the next 8 hours. And speaking of the bedroom, there's another factor almost nobody associates with heart health, even though it surrounds you for the entire night. It isn't your mattress, your pillow, or your blankets. It's the temperature of the room where you sleep. Habit 5. Sleeping in a bedroom that's too hot or too cold. In fact, most people think it's simply a matter of personal comfort. Some people like a warm bedroom. Others prefer it cool. Few ever stop to ask whether the temperature where they sleep could affect the way their heart works throughout the night. The answer is yes. More than many people realize. When the room temperature stays too high, your body has to work continuously to cool itself down. Blood vessels near the surface of the skin widen to release heat. Your heart beats faster to move more blood through those vessels, and you lose additional fluid through perspiration. Even if you don't notice yourself sweating, that extra fluid loss can leave you slightly dehydrated by morning, adding to the very problem we discussed a moment ago. A hot bedroom also makes it harder to reach the deep stages of sleep. Instead of spending the night in restorative sleep, you wake more often without remembering it. Your nervous system remains more active, and your heart doesn't receive the period of quiet recovery it needs after an entire day of work. Now consider the opposite situation. Many older adults keep their bedroom very cold because they believe cooler always means better sleep. But if the temperature becomes too low, your body responds in a completely different way. Blood vessels begin to constrict in an effort to preserve body heat. As those vessels become narrower, blood pressure rises. The heart has to pump against greater resistance to circulate blood throughout the body. For someone living with hypertension, coronary artery disease, or stiffened arteries, that additional workload is far from ideal. Instead of resting peacefully, the cardiovascular system spends the night working harder than necessary. Most sleep specialists and cardiologists recommend keeping the bedroom between 18 and 22 degrees Celsius, or approximately 65 to 72 degrees Fahrenheit. Within this range, your body is generally able to regulate its temperature without placing unnecessary stress on the heart. Blood vessels remain more relaxed, heart rate stays steadier, and you're more likely to enjoy the deep, restorative sleep that supports cardiovascular health. If your bedroom often feels stuffy, improve air circulation by using a fan or opening a window when weather permits. If it feels excessively cold, add another blanket instead of turning the room into an icebox. Sometimes the smallest adjustments produce benefits that are almost invisible from one night to the next, yet become meaningful over months and years. Now we've covered 5 common bedtime habits that quietly place extra strain on the heart. How do you put all of this together into a simple evening routine that's easy to remember and realistic enough to follow every single night? Here's the routine I recommend. Between 6 and 7 in the evening, eat your main meal. Make dinner satisfying but not overwhelming. Include lean protein such as fish, chicken, beans, or tofu, along with plenty of vegetables. If you enjoy carbohydrates, keep the portions moderate. Finishing dinner early gives your digestive system enough time to do its work before your heart shifts into its nighttime recovery mode. Around 7, think about medications and hydration. If you take blood pressure medication, follow the schedule recommended by your physician. If you've never discussed the timing of your medication, make a note to ask during your next appointment. At the same time, drink a small glass of water, just enough to stay well hydrated through the night without overfilling your bladder. Between 8 and 9, take a gentle walk around the neighborhood. Read a favorite book. Listen to relaxing music. Spend a few quiet moments talking with your spouse or family. Most importantly, begin stepping away from bright screens. Phones, tablets, and televisions stimulate the brain and make it harder for your body to enter a restful state. Around 9, prepare your bedroom. Check the temperature and keep it comfortably between 18 and 22 degrees Celsius or 65 to 72 degrees Fahrenheit. Place a glass of water beside your bed in case you wake up thirsty during the night. Create an environment that tells both your brain and your heart it's time to rest. By 10, try to be in bed. A consistent bedtime helps reinforce your body's natural circadian rhythm, allowing your blood pressure and heart rate to follow the healthy nighttime pattern they're designed to follow. And if you snore, or if someone has ever told you that you stop breathing while sleeping, do yourself one additional favor. Sleep on your side whenever possible. For many people, this simple position helps keep the airway more open and may reduce episodes of airway obstruction while you arrange for a proper medical evaluation. Notice that none of these steps are complicated. They're simply small decisions that work together, night after night, to reduce unnecessary stress on your heart. Unfortunately, many people don't realize how powerful these small habits can be until it's too late. I've seen that reality firsthand, and I'd like to share one experience that has stayed with me throughout my entire career. I've stood in operating rooms at 3 o'clock in the morning while an entire medical team fought to restore blood flow to a heart that had suddenly failed during the night. I've walked into waiting rooms just before sunrise to speak with families who couldn't understand what had happened. Only hours earlier, they had hugged their loved one, wished them good night, and expected to see them at breakfast. Instead, they were sitting in a hospital, searching for answers. I've also read countless medical reports after patients had already passed away. Every case tells a story. And although every patient is unique, I began noticing something that was impossible to ignore. More often, it was a series of small habits that had quietly accumulated over many years. A heavy dinner just before bed. Blood pressure medication that was missed or no longer providing protection through the night. A body that became dehydrated every evening because someone was afraid of getting up to use the bathroom. Years of untreated sleep apnea that everyone dismissed as just snoring. A bedroom that stayed uncomfortably hot night after night, preventing the heart from getting the restorative sleep it needed. In fact, most people considered them perfectly normal. That's what makes them so deceptive. Heart disease often develops in silence. Then one night, when the heart is under just a little more strain than usual, everything changes. People often ask me, "Doctor, was there anything we could have done?" But because they simply didn't know that these ordinary evening habits mattered, that's why I wanted to share this information with you today. Knowledge cannot guarantee that a heart attack will never happen, but it gives you something incredibly valuable. The opportunity to reduce risks before they become emergencies. After more than 2 decades in cardiac surgery, I've come to believe that one of the greatest differences between many patients isn't luck. It's information. The people who understand how everyday choices affect their heart are often the ones who have the best chance to protect it. If there's one message I hope you take away from today's discussion, it's this. Protecting your heart doesn't always require a new prescription, an expensive procedure, or a dramatic lifestyle change. Remember, your heart has never taken a single night off. It has worked faithfully every minute of every day throughout your entire life. Tonight is a wonderful opportunity to return the favor. Before you leave, I'd love to hear from you. Which of these 5 bedtime habits surprised you the most, and which one will you start changing tonight? Share your answer in the comments below. Your experience may encourage someone else to take that first important step. If you found this video helpful, please consider sharing it with a spouse, a parent, a sibling, or a friend over the age of 60. One simple share could provide someone with information they never knew they needed. And if you enjoy this kind of evidence-based content and would like to see more videos dedicated to helping older adults live healthier, longer, and more independent lives, subscribing to the channel is one of the best ways to support our work. Finally, a small personal note. Many of you have asked how you can support the channel beyond watching our videos. If today's discussion gave you valuable information or helped you see your health in a new way, you can support our work through the Super Thanks feature below this video. There is absolutely no obligation, and simply watching, commenting, and sharing is already deeply appreciated. But for those who choose to contribute, your kindness helps us continue researching, producing, and sharing thoughtful health education for older adults around the world. Thank you again for watching. Sleep well, take good care of your heart, and I'll see you in the next video. Medical disclaimer. This video is intended for educational purposes only and should not replace personalized medical advice. Always consult your physician before changing your medications, treatment plan, or health routine. Stay safe and take good care of yourself.